All right, greetings. So we are discussing cardiac volume and stroke, cardiac output and stroke volume in a cardiac cycle. So this is continuation of the previous lecture that was about cardiac cycle. So notice atrial contraction is, as you can see, atrial contraction or the atrial systole, right? So at that time, the ventricle is open and it is receiving blood. You can see the arrows going in. The ventricle is open and it is receiving about 70 to 80 ml blood. Okay, this is the atrial systole. Now, as soon as the ventricular systole starts, notice the valves, atrioventricular valves close down. And you can see the pressure in the atria, in the ventricle is building up. So how do we represent this? So two things here. In terms of ECG, we are looking at this area. And in terms of early ventricular systole, that is, it is called early ventricular systole. This is an active state. It's active. That's what you fill in, active, because there is muscle contraction. And because the muscles are contracting, the pressure is going up. The volume is not changing. It's equal, it's not changing. The amount of blood that is in the ventricle at this time is called EDV. If you expand it, it means end diastole volume. Okay, good. So we have just done one calculation. That is just before anything else happens, we just want to know how much blood is in the ventricle. At this point, the blood is about 120 ml in a healthy person. So this is, again, one cardiac cycle. We are going into our first end diastole volume, and we have that value. This is the early phase of contraction. What happens next? The pressure keeps building, obviously, because there is polarization in the nerve conduction. So the pressure in the pressure vessels are still working. As a result, notice what happens here at the end of the ventricular systole, right? This is the second phase. Notice arrows to the pulmonary valve, pulmonary trunk, and the aortic trunk opens up. Because the pressure is so high, those valves open up. Okay, so what can we say about this phase? Late, this is not early, this is late ventricular systole. Okay, it is also an active phase. This is active as well because there is contraction. The pressure in the chamber is high, of course, because you can see the muscles are contracting. Volume, here it was equal, volume is down here. It's going down. What is happening here? Blood is pushed out. So this is happening for, in the ECG, you can think about this is happening right around at this end. Okay. All right. So this was all about the ventricle. So ventricular contraction is now done. Now the ventricle is going into a relaxation stage, right? So it is a ventricular diastole early. So you can see that these valves that were pushing out to the pulmonary trunk and the aorta, they have shut down. They are closed. That's the first thing that happens, so that the blood cannot come back in. First thing, so they close. Okay, what happens to the pressure? Pressure in the chamber goes down. There is no net flow of blood at this point. Just that the valves for the aorta and the pulmonary trunk are closed. So the volume in the ventricle is not changing. However, we know from experimental data, some amount of blood still remains. Okay, it does not, it's not able to push out everything. Okay, so that volume of blood that remains is called ESV, or end systolic volume. Okay, that's what it's called, end systolic volume. There's some amount of blood remaining. Continuing further, we are now in the late phase of the ventricular diastole, right? Ventricular diastole. Pressure, as we already know, there is no pressure building up. Pressure is low. However, now the AV valves are open, so the atrium is now able to bring in blood. So the volume is now going up. Okay, so blood is filling in the ventricles. Okay, this is again, now we are looking at the almost end. So we are going past the T phase, it's right here. Okay, and when now the blood is kind of flowing and it is getting ready for the next cardiac cycle. So this was one cardiac cycle output.